And welcome yet again. I've had the double whammy today, and I have the pleasure of Dr. Wysynski with me. We're going to continue our discussion. Part one was about bioidentical hormones and what they are and what they're made from, and why we need to look to bioidentical hormones for our aging health. So now we want to talk a little bit about the process, because I'm sure you're just loaded with questions from the first one. So the process. And I will tell you and share a little bit of personal information. I have been through the first few steps with Dr. Wizz here. And the first thing that she sent me was a health questionnaire. Now, being somebody who practices natural health, this questionnaire absolutely astounded me. It is the best and well put together questionnaire, Dr. Wizz, that I have ever had to put myself through.
Thank you.
So if you could just take a minute just to explain your thinking in the questionnaire that you developed.
Thank you, Trish. The questionnaire actually is not a health questionnaire. I call it my medical intake form.
Okay.
So it goes basically from birth to death, everything about your life, including your trauma, your family of origin issues, to what age you achieved menarche or you had your period, came into puberty, right down to what do you eat, how do you poop.
Yep.
We actually give you a scale.
Oh, a chart. Yeah,
a chart, and you have to write down your poops, poop diary.
Yeah, and the food diary for a week. Yeah.
Exactly. In addition, I fashioned my questionnaire, my intake questionnaire, around an internal medicine style or an internal medicine level interview. So if I were to, as a family physician, refer you to a specialist, a specialist should ideally, by training and like I say, it's the ideal, go through all of these questions.
Right.
What are your medications? What's your past medical history? What's your past surgical history? Psychiatric history? How long have you been on hormones? What is your reproductive history? How many times were you pregnant? Did you have infertility? Did you have PCOS? Did you have ovarian cysts? All of this gives me cues and clues. So remember in the first part, I said that I'm really good at the minutia. I can understand the minutia, but then I can really get that into the big picture. When somebody is talking to me through their, when we do the first intake, the medical intake, we go through this questionnaire with a fine-tooth comb. And my CPU is running at high speed all the time because I'm like, oh, note to self. Oh, note to self. Oh, wait a minute. Need to clarify that. Can you expound on that and tell me more about it? So it almost seems redundant for the patient to go through the exercise of filling this in and then meet me and speak about this. That interview process, there's several pieces for me and the patient. It gives me that information, helps me put layers together, starts me formulating the plan for the patient treatment plan. But it also gives the patient time to feel confident. We build communication. We build trust in that relationship. They get to feel me out. They get to hear my crazy sense of humor, because I do have a kind of a British wry humor. That's why maybe we get along so well. But also, I mean, if I'm going to ask you about, as a woman, how wet is your vagina and how painful is your sex? Are your breasts tender? Or a man, how tumescent or firm the erections are, and can you last long enough to satisfy your partner? There better be some trust in that room.
So just to clarify, you do hormone replacement for men?
Correct.
Okay. So I will say, when you get this questionnaire, it's the first thing that happens. You need 90 minutes to 2 hours to fill that little sucker in. So, but it's well worth the journey. It certainly starts you thinking. And then I've only got to stage 2, where I went in for the interview. And again, it's flashed up on a screen, and there is a really in-depth conversation that takes place, and how Anna-Marie can actually start then to personalize what it is and, that you need, and really, really get to know you. As she said, she receives cues. All right, so now we go to the testing process. At the end of that interview, you're going to come out of there with a kit.
So at the end of the first interview, the intake, it depends on the journey where people want to go. Typically, most people want to proceed, but that is also a point where somebody may say, I'm not quite sure this is for me. A conversation then will ensue. Pros and cons, Most people know the pros and cons before they seek somebody out. But if not, we talk about the pros and cons. Testing may not even occur, Trish. Some practitioners do not test. Or, actually this past weekend, I met a woman who is not a professionally trained healthcare provider at all, but has a background in running a health food store and is a general person from the population who's allowed to acquire certain machinery or testing materials, and she's actually doing something very similar in terms of hormone of supporting hormones, can't write a prescription.
Right.
So the level of expertise that you enter into the relationship for the practitioner is really important.
Totally.
So people are saying that they're doing hormone replacement therapy out there, or hormone enhancement for men and women. It's interesting. And often many of my colleagues don't test.
Right.
And if they do test, they often test on blood. And if they do test, they're not testing your hormones. They're testing precursor hormones from the pituitary called LH and FSH.
Right.
So luteinizing hormone and follicle stimulating hormone.
Yes.
So these are hormones that are produced from the pituitary, a little gland in the brain, that talk to our ovaries to tell them to make hormones and in what cycles.
Right.
There's a fantastic physician colleague of mine who was also a teacher and mentor through my training. His name is Eldred Taylor. And he goes through a whole tirade of why FSH and LH are completely useless for telling a woman if they're in menopause.
Yep.
And part of the reason is when our organs are listening, like our ovaries, then the pituitary just has to talk softly.
Right.
But if the ovaries are getting a little bit resistant to signaling, then the pituitary has to talk louder, which means that the levels of the hormones go up.
Right.
So one of the things that drives me insane for women and women's health is when doctors like me are trained to do this, and then you walk in and you've got 97, I'm exaggerating, but 97 symptoms. There are actually 65 of them actually in perimenopause and menopause. But then the doctor takes the paper and goes, "You're fine. You cannot be fine in my mind if you are symptomatic."
Correct. And I think that explains the frustration of so many women, where they go for a test, even if it's a thyroid test, you're experiencing symptoms, but it comes back as normal. Okay, so what now? And it's the same with menopause, and of course every woman, based on genetics and lifestyle, does it completely differently.
Exactly.
So I can only stress to you how important this individual testing is from somebody who knows what the heck they're doing and doing proper testing. When I saw the sheet on my test and what she was testing, it was like, wow, that's amazing.
Did it make sense?
It made sense to me.
Right.
Absolutely, especially after the interview that we'd had after my healthcare questionnaire. So very important. Right.
One thing I learned in my graduate school training, and my mentor was amazing. So when I was doing my PhD study, they said to me, "You will get lots of information from your investigations, from your experiments.
Right.
But if you want to get the right answer, ask the right question." So in graduate school, if I wanted to prove my hypothesis or have the study say what it was going to test and prove that we found an answer to that, ask the right question.
Right.
So I say in hormone testing, if you want the right answer of what the hormones are doing, look in the right compartment.
Right.
So the three main compartments, well, there are four. You could do a brain biopsy, a breast biopsy, a bone biopsy. That is ridiculous and would never be tolerated or ethical. There's blood testing, which we talked a little bit about the risks and benefits of that. There is saliva testing, and there is urine testing.
Right.
I will test blood because every once in a while I get a really tough case. So remember we talked in the first section that there are about 10% of women that won't have any hormone symptoms.
Right.
About 80% of women with symptoms will be fairly easy and really quick to respond, and there's about another 10% of women who will struggle. And sometimes I need to go back to the basics of their pre-treatment blood work. But typically I will use saliva and I will use urine.
Right.
And there are different stories of what you get. The saliva gives me the intracellular levels. That means what's happening in the cells.
Right.
So when the saliva is collected, we could proxy measure or associate that level of hormone with what's going on in the ovaries or the brain or the bones. The urine testing can be used for dosing, but traditionally urine testing for me and my understanding and my scientific background tells me that this is exquisitely good for metabolism.
Right.
How do we break down? How do we handle our hormones naturally or exogenously when we put them on or take them by mouth? So
Right.
that testing for me is exquisitely important, especially for women with a first-degree relative, so mother or sister with any kind of
Right.
female reproductive
Yeah, because
cancer.
it's the urine is the end result of everything that's broken down. You're excreting it out,
Exactly.
and that tells a story. Right.
Exactly.
Okay. So, to save a little time here, I did do already a little video of myself on doing the package that Anna-Marie gave to me. So there'll be another little video that shows you what's in the package and what's involved in saliva testing, which is very much her choice of modality for testing. So what I don't know about, and I'm going to ask the question, is what happens when the results come back? And it does take about 5 weeks
Sadly,
to get the
right now,
results
yes.
back. Yes. 'Cause
Not
it's-
in my control.
Right, right. But what happens next once the results come back? Where do we go from there?
You'll have another appointment with me where we
Yep.
go through those results with a fine-tooth comb.
Yep.
I tell you in detail, and even though I don't need you to understand it, I need you to get the gestalt of what's happening with your body.
Right.
And then from there, I create a plan, ask you your preferences, because there are different routes of taking this. And some people want to use the drug plan,
Mhm.
which there are bioidentical hormones that are synthetic,
Right.
and there are natural bioidentical hormones. So for example, estrogel, it is bioidentical, but it's made from chemicals, completely from chemicals. So it is a synthetic bioidentical. So based on preferences, drug plans, cost, approach, I will explain what I would like to do. If people would rather have a capsule or a cream, then that's all where the negotiation between the patient and the physician come in. The third part of this relationship is the pharmacist.
Right.
If we don't have a reputable, experienced, outstanding compounding pharmacy to create the bioidentical mixtures, because it's like making a milkshake or any recipe in your house, a chef does it better than a novice any day. So if we don't have a good three-way relationship between patient, physician, and pharmacist, it doesn't work.
Right. So I just want to clarify. Anna-Marie did say compounding pharmacist. Not every pharmacist is a compounding pharmacist.
Correct.
So that's an important part. So you pay a visit to the office, you determine what the patient needs,
Yes.
and you actually send that to your compounding pharmacist, or does the patient get a prescription and take it to the compounding pharmacist?
Normally, we try and give a higher level of customer service at
Right.
our clinics, so we offer to fax the prescription. Generally, if we have a really good relationship with the pharmacist, or they do a lot of pharmacy compounding, they will usually have the prescription ready within a day or two.
Okay.
Some pharmacies compound every once or twice a week only.
Right.
Some get it from their sister pharmacy and then it has to be shipped. So the timeline for starting is anywhere from 1 day to a week.
Okay. All right. So I guess the obvious question that people are asking, you did briefly mention drug plans.
Yes?
So is it a drug plan thing? Can it be an OHIP thing? And if it's
Right.
not, and if you're like me, self-employed all my life, then it's a private thing. So can you give us some idea around what is available, and if it's not available
Yes.
under OHIP, what kind of cost does that look like? And I know it's going to be varied, so just a general kind of idea.
So bioidentical hormone replacement therapy
Mm.
is considered complementary medicine.
Yeah.
Because it's not the standard pharmaceutical one-size-fits-all medicine,
Yep.
or a pill for every ill, as we call it,
Yep.
then it becomes out of OHIP.
Okay.
So the visits, the testing are out of OHIP. Let's look at a worst-case scenario. Somebody
Yep.
like yourself
Yep.
who is self-employed, and let's assume you don't have any secondary healthcare coverage that you've paid into.
Yep.
So somebody who's paying costs out of their pocket, they will
Yep.
pay for their visits, their consultation and their office visits.
Yep.
And then they will pay cash or credit, whatever, for their their monthly medications, which we usually prescribe, you're not running to the pharmacy every month. And that generally is approximately $50 per prescription per month.
That's pretty reasonable considering.
It's about less than
Yeah.
a cup of coffee through a drive-through
Absolutely.
per day.
Yeah, yeah, yeah.
And the difficulty becomes when somebody has maybe 3 hormones or 4 hormones, if they get several months worth. Now if you're getting 4 months worth, it's $120 or $150 per.
Right.
But the cost at the pharmacy is determined at the pharmacy.
Yeah.
Every pharmacy is different.
Yes.
But the cost comes in because now we have somebody in a controlled environment. They wear almost like a hazmat suit because the person who's compounding your hormones. Not that they're dangerous for you, but they are exposed day to day. It's the same idea why we now have self-serve gas stations, because
yeah.
the gas station people who were serving it day to day when it was leaded were getting sick. So the person suits up, they get into a controlled environment with special airflow,
Right.
and they custom compound the hormones. So
Right.
they have to, the hormone charges at the pharmacy in part are how much time is spent
Taken.
in the hood.
Right, in the
Right?
hood, in the
We
hood.
call it in the hood,
In the
the
hood,
neighborhood,
right,
the
that's
menopause
a
hood,
good
right? But it
analogy.
literally is the hood because there's specific airflow to keep, you know, that
Right.
person from breathing in the hormones, etc.,
Right.
and keep the environment sterile. That's the other thing. It is
Yep.
sterile compound, semi-sterile compounding.
Right,
And so the patient will then be called from the pharmacy. If they live close, they may pick it up.
Yep.
If they don't live close, most pharmacies deliver, usually by courier.
right.
A little bit of difficulty in the winter and in the hot heat of the summer, but we figure it out, and
Yep.
we've made it work for almost 20 years, so it
That's
does work.
fantastic. Well, thank you so much, Anna-Marie. I hope we've answered most of your questions and absolutely your concerns. And I do want you to remember that the world of understanding women's bodies and the amount of research that is putting especially into baby boomer research and keeping them well and keeping them healthy so they can be their best at every age is huge. It's so different from 10 and 15 years ago. And Anna-Marie is a part of that. I know if you are interested in this, and all the information is at the end of the video here for you, you will just love working with her. She's a hoot. And she's very informative, and she will actually answer all of your questions. So again, thank you for listening in, and the information, if you have questions, is at the end of this video, and I look forward to our next little video that we're going to do about how to manage your early perimenopause symptoms and what those look like. Thank you.